WHO, about 63% of global deaths are due to these non-communicable diseases, and they're increasing. Even cancer is a non-communicable disease, but the popular ones that people are afraid of are the ones that get the most attention.
Wow. I'm just getting very emotional just listening to you because before my father died in November last year of complications from diabetes and hypertension, I never took this as, anything to think about. These weren't like serious issues to me. Even he didn't know. He was 69 and he didn't know that he was diabetic. So we've been talking a lot on this show about food, about exercise, but you have to be aware that you're dealing with something to be able to manage it. Absolutely. Like if I have hypertension, I've heard that you shouldn't eat a lot of salt or something. I don't know if it's true, but you don't even know what to stay away from if you don't know that you're dealing with something. But in a place like Nigeria, let's use Nigeria where we both know very well, there isn't the opportunity to find out what you have because people don't go to the hospital unless they're sick. So how do you change this? Do you start buying kits to test yourself at home or what?
So that's a really good question. So that's the thing. Nigerians, we generally do not have the culture of health. And so that means Nigeria is a curative system or a sick care system. When you're sick, you go see a doctor. What we're trying to promote is you don't have to be sick before you see a physician. And that's what my organization is doing. Our organization is called Magna Carta Health. And this is what we do. We're trying to make people more aware of the fact that you need to manage your healthcare preventatively. You don't have to wait because by the time you wait, you're already exposing yourself to the complications of the disease. And so you want to take a step. It's important. You have to step up for your health. Just like you step up for work, step up for parties, you have to step up for your health. And it's a lot of stuff, but it's doable. So it's not just going to see a doctor. It's knowing that your lifestyle choices impact your health for the good or for the bad. And so when you talk about exercise, when you talk about diet and things like that, they're really important. So if you have hypertension, it's not just going to see your physician. And I think that's the error a lot of us make. We go and see a doctor. Well, I go see my doctor, I take my meds. Yes, but what is your lifestyle like? What are the things that you're doing that are impacting?
Lifestyle like?
Is your diet not good for a hypertensive patient? Do you have some challenges with activity? Are you sedentary? So do you work at the desk all the time so you don't get time to exercise? And we don't have time in Nigeria. And so that's why we're asking our employers to take an important step up in helping their employees manage their health, because they have to realize that these population of people, their employees are their most important asset. And if they invest in their employee health, their employees will be healthier and they'll be more productive.
And this sounds easy for me to understand because here as an employee here, my employer invests in